Takeoff Immigration Services, United Kingdom. This video is intended to provide information on the Health and Care Visa. The Health and Care Visa is part of the Skilled Worker Visa. As the Health and Care Visa currently forms part of Skilled Worker, anyone wishing to apply for the Health and Care Visa must meet all of the requirements for the relevant route. This visa route came into force on the 29th of January 2021. Health and Care Visa. 1. The government committed to introducing a health and care visa for qualified doctors, nurses and allied health professionals who have been trained to a recognized standard and who have good working English. The scope of the visa was extended to include eligible persons working in the social care sector. The benefits for such workers are fast-track entry, reduced visa fees and dedicated support to come to the UK with their families. In addition, as announced by the UK Prime Minister, Johnson on the 21st of May 2020, people applying for the Health and Care Visa, and their dependent family, are exempt from paying the immigration health surcharge. This offer forms part of the skilled worker route. The Health and Care Visa was launched on the 4th of August 2020. Eligibility. 2. The Health and Care Visa is available to the following individuals: a person applying under the skilled worker route for entry clearance or leave to remain, and a person taking up a job in one of the occupations specified within the list of Standard Occupational Classification (SOC) codes set out later in the video, and a person who will be employed or engaged by 1. An NHS Foundation Trust in England, an NHS Trust in England, the Care Quality Commission, Health Education England, Health Research Authority, Human Fertilisation and Embryology Authority, Human Tissue Authority, Medicines and Healthcare Products Regulatory Agency, National Institute for Health and Care Excellence, NHS Blood and Transplant, NHS Business Services Authority, NHS Digital, the Health and Social Care Information Centre, NHS England, the NHS Commissioning Board, NHS Improvement Monitor and the NHS Trust Development Authority, NHS Resolution, the NHS Litigation Authority or Public Health England, a local authority or clinical commissioning group, or 2. A local health board in Wales, Health Education and Improvement Wales, Public Health Wales, the Welsh Ambulance Service or Velindre NHS Trust, or 3. A health board or special health board, Scotland Common Services Agency for the Scottish Health Service. Social Care and Social Work Improvement Scotland, known as the Care Inspectorate. 4. A Health and Social Care Trust in Northern Ireland, Northern Ireland Blood Transfusion Service, Northern Ireland Guardian Ad Litem Agency, Northern Ireland Medical and Dental Training Agency, Northern Ireland Practice and Education Committee, Northern Ireland Social Care Council, Patient and Client Council, Regional Agency for Public Health and Social Wellbeing, the Public Health Agency, Regional Business Services Organisation, Regional Health and Social Care Board or Regulation and Quality Improvement Authority, or a person who is employed to provide, or to support the provision of, regulated activities to the health and social care, and who is also employed or engaged by an institution or organisation registered with the Care Quality Commission, or b. For the purposes of an establishment or agency in Wales regulated by Care Standards Act 2000, or c. For the purposes of a service regulated under Part 1 of the Regulation and Inspection of Social Care Wales Act 2016, or a person who is employed or engaged by a party to a general medical services contract to provide primary medical services, or an agreement for the provision of primary medical services under Section 50 of the NHS Wales Act 2006, or b. a general dental services contract to provide primary dental services, or an agreement for the provision of primary dental services under Section 64 of the NHS Wales Act 2006, or a person who is providing care services or engaged in connection with the provision of services under the National Health Service Scotland, a person who is employed or engaged by a General Practitioner Federation or by any entity with which the Northern Ireland Regional Health and Social Care Board has a contract or an arrangement under the Health and Personal Social Services Northern Ireland to provide family practitioner services, or A person who is employed or engaged by a body registered with, or monitored or inspected by, the Regulation and Quality Improvement Authority. A person employed or engaged by, or registered with, one of the following organizations: General Chiropractic Council, General Dental Council, General Medical Council, General Optical Council, General Osteopathic Council, General Pharmaceutical Council, Health and Care Professions Council, Northern Ireland Social Care Council, Nursing and Midwifery Council, Pharmaceutical Society of Northern Ireland, Scottish Social Services Council. A person employed by an organisation providing adult social care services. Adult social care services means any services which an English local authority must or may provide or arrange for a. Mental health, b. Care and support. The health and care visa will apply to the following list of standard occupational classification codes. 1181 Health Services and Public Health Managers and Directors. 1242 Residential, Day and Domiciliary Care Managers and Proprietors. 2112 Biological Scientists and Biochemists. 2113 Physical Scientists. 2211 Medical Practitioners. 2212 Psychologists. 2213 Pharmacists. 2214 Ophthalmic Opticians. 2215 Dental Practitioners. 2217 Medical Radiographers. 2218 Podiatrists. 2219 Health Professionals not elsewhere classified. 2221 Physiotherapists. 2222 Occupational Therapists. 2223 Speech and Language Therapists. 2229 Therapy Professionals not elsewhere classified. 2231 Nurses. 2232 Midwives. 2442 Social Workers. 3111 Laboratory Technicians. 3213 Paramedics. 3216 Dispensing Opticians. 3217 Pharmaceutical Technicians. 3218 Medical and Dental Technicians. 3219 Health Associate Professionals not elsewhere classified. 6141 Nursing Auxiliaries and Assistants. 6143 Dental Nurses. 6146 Senior Care Workers. This is an exhaustive list. Applicants must be taking up a job in one of the above occupations to be eligible for the health and care visa. 4. In addition to the requirements set out in this video, applicants for the health and care visa will need to meet all relevant criteria for a skilled worker. These requirements are set out in the Immigration's rules at Appendix Skilled Worker and include a requirement for applicants to work for a UK employer that's been approved by the Home Office UKVI. Have a certificate of sponsorship from their employer with information about the role they've been offered in the UK. Do a job that's on the list of eligible occupations. Be paid a minimum salary. How much depends on the type of work the applicant does. Be able to speak, read, write and understand English at the required level. Employer requirements. 5. The employer will be required to include a brief explanation in the certificate of sponsorship setting out how the employee meets the health and care visa eligibility requirement. 3. The employer will also be responsible for informing the applicant they are eligible for the health and care visa so the applicant can correctly complete the visa application form. Where an employer is an organization that provides services commissioned by the NHS, evidence of the contract arrangements with the NHS may need to be provided to UK Visas and Immigration (UKVI) as proof that applicants are eligible to apply for a health and care visa. Visa fee reduction. 6. Individuals applying for the health and care visa will apply using the normal skilled worker application form and, assuming their employer has confirmed how the employee is eligible, the applicant will check the box to confirm they are applying for the health and care visa. Health and care visa applicants will pay the reduced application fees. All visa application fees, including for the health and care visa, can be found at the UKVI website. Once they have completed all the relevant information, the application process should automatically route health and care visa applicants to the payment page where the appropriate fee will be applied. 7. The visa fee reduction applies to partners and dependents of health and care visa applicants. Partners and dependents of health and care visa applicants should therefore also tick this box. 8. You should not tick the health and care visa box if your employer has not confirmed on the certificate of sponsorship that you are eligible. Where an application is made, but the applicant does not appear to meet the conditions, that application may be rejected, as the correct fee will not have been paid. If you are unsure, you should check with your sponsor before completing the application. 9. If you are applying as a partner or dependent of a person who qualifies for the health and care visa, but the qualifying person arrived in the UK before the health and care visa was available, then you will need confirmation from the sponsor that the person upon whom your application is reliant is eligible for the visa. The sponsor will need to provide the information, which would normally be included in the certificate of sponsorship, to the applicant for inclusion in the partner or dependent application. This should be in the form of a letter or an email from the sponsor and would set out the organization and, if not an NHS body, how the organization qualifies under paragraph 2 of this guidance. 10. In addition to the reduced visa fee, applicants applying for the health and care visa and their family are exempt from having to pay the immigration health surcharge. Family is defined as the partner or dependent child of the person applying for the health and care visa. It does not cover wider family or those living independently of the health and care visa applicant. Fast track entry. 11. Good news. UKVI will prioritize health and care visa applications, with the aim that the vast majority are processed within 3 weeks from the point the applicant has provided their biometric information. This is in comparison to the current timeframe for visa processing of between 8 and 20 weeks. Dedicated NHS support and visa processing team. 12. Takeoff Immigration Services can assist from beginning to end of the process. Our full support services are in a separate video on this channel. Potential candidates can contact Takeoff Immigration Work Visa section at info@takeoffvisa.com. WhatsApp, Signal, Telegram, +4 4730 907 6819. Takeoff Immigration Services is a private organization regulated by the Home Office's OISC. We provide dedicated services to agents, employers, and individuals. OISC registration. F201200646. This video is for information only and is not full legal advice for this visa application process. Please subscribe below and keep up to date with relevant immigration matters.